Yeah, in dogs, we predominantly get secondary osteoarthritis. Right? And we're going to talk about some of the screening for that. But that's the majority. Right? Dogs can still have perfectly good joints for years and still wear them out, as we see dogs in the US living longer and longer. We can still get primary OA, not just because they had really great radiographs when they were 2 or 5 or 8. Doesn't mean when they get to 13, they still can't have primary OA. They can get there. The small minority of cats can get early stage OA. Right? They could have joint disruption from a fracture, just like a puppy could. Doesn't have to have dysplasia. Could have a joint fracture. Could have some other incident early in life that's not a genetic or heritable component, but they can still get those. When we get dogs, though, with the majority of cases that are secondary osteoarthritis from a dysplasia, we can do a lot better. We've done a lot better in the last couple of years about being aware of that. But that comes on the front lines of the primary care veterinarians. And what are the goals of that puppy? When that puppy comes in, you see it for its 3-month exam, touch and feel its joints, right? They should be loosey-goosey. They should be nice and wobbly and comfortable, right? They're not painful. They're standing up well. They're walking well. Hip dysplasia. We can detect hip dysplasia as early as 16 weeks of age in dogs. Right? We can do that from our physical exam because the key to hip dysplasia is laxity. Right? Here's my femoral head. Here's my femur. Here's my acetabulum. Right? When puppies are little, it's just everything's built nice and normal. But what shapes the acetabulum as the puppy grows is that the femoral head is snug inside of that. So as that little puppy is growing, it's its own little 3D printer, right? If this is nice and snug, then as that acetabulum grows, it's going to still grow around that. Hip dysplasia is the disease of laxity of the hip. So if we have laxity, then as that acetabulum grows, it doesn't get the message from the femoral head. So it doesn't grow like this. It grows loose. And now that femoral head bangs around in there. It's stretching that synovium, that joint capsule every day. And you're getting a lot of inflammation. How do we detect that? Well, we can feel for that with our physical exam. And if we're suspicious of it, we can do radiographs. Pen hip radiographs are validated all the way down to 16 weeks of age. So if you have a sporting dog with aspirations of competing, or a working canine, or just being diligent, maybe your last dog had really severe hip OA, talk to your veterinarian about getting a set of pen hip rads done at 16 weeks. There we can objectively measure exactly how loose that joint is. We get what's called a distraction index. And that distraction index is a ratio between how snug and how loose that joint is from a series of stressed radiographs. We get a number somewhere between 0.0, no movement. We actually don't want that. We want some, all the way up to 1.0. And that ratio, when that ratio is 0.3 or less, they have virtually no risk of developing osteoarthritis. Secondary, right? They're snug. As they go up to 0.4, 0.5, 0.6, 0.7, right? That joint is looser and looser. They may not have osteoarthritis at 16 weeks, but we know that they're at mild, moderate, or severe risk based off of the number that we get from that. And that's been proven through years and years of research that we can absolutely measure that appropriately with sedated radiographs.